Hi, I'm Kevin Lee with the eMarketing Association. Most people know me as the co-founder of Did It, which I've been doing for 25 years, starting in search marketing and then having made 11 acquisitions to become a full-service marketing agency. I also have a nonprofit called Giving Forward, which is in the cause marketing business. Uh, I have the pleasure of chatting with Alexandra Morehouse today, who is the CMO of Banner Health, but also has a bunch of other roles, most notably being on the board of the ANA, the Association of National Advertisers. So thanks so much for joining me, Alexandra.
My pleasure, Kevin. Glad to be here.
Great. Well, as a board member of the ANA, and you've also got a bunch of other advisory positions on boards of startups, you're exposed to a lot of conversations across industries, not purely healthcare. And of course, your prior roles have exposed you to non-healthcare related industries as well. So obviously, since the pandemic, a lot of things have changed and a lot of things have remained the same. From the conversations you've been having with other organizations or with other marketing folks in other organizations, what do you feel like marketers are really struggling with now?
I think because everybody was isolated during the pandemic, it accelerated digital shopping and also changed expectations for channels of distribution. So, certainly for healthcare, but across all industries, the call, click, or visit marketing mix and the channels of distribution, the expectations have changed. And in order to meet those expectations, marketers have to step over their traditional boundaries and spend a lot more time on the data side. Because in order to fulfill on those distribution channels, you have to be able to follow the data and actually collect and use the data on each customer. So I know I'm talking to Kevin and what sorts of products and services you want.
Right, right. Well, certainly e-commerce for many marketers, if they're multi-channel marketers, they've got place-based and they've got pure digital, or they may be a pure play. And similarly in healthcare, right, it used to be very place-based, but certainly the pandemic has accelerated telehealth in many ways. So, some of your touch points as a healthcare organization have become virtual as well. Do you feel like the health industry has embraced that, or that the digital transformation is facing a lot of headwinds?
I think that there has been some progress and there's still a lot of headwinds because all of healthcare is built for going into a clinic, bricks and mortar, sitting in front of a physician. And that's really what you and I and most of your listeners would expect. So, changing the expectations and actually teaching an entire customer base how to consume healthcare in a different way, how to use a digital symptom checker, how to call a nurse online, when to use urgent care versus actually a full on doctor's appointment. All of those things are changing. And in some ways, I think of it as the way the airlines had to retrain all of us. So, you and I right now would never dream of booking an airline trip online. We wouldn't dream of we wouldn't dream of booking in person. We wouldn't dream of calling someplace to actually book a reservation. We wouldn't dream of checking in except online, but the airlines had to coach the entire public through that, and we're having to do the same thing with healthcare consumers.
In the healthcare industry, obviously, there's a third organization or a third industry essentially that acts as either a facilitator or a blocker, which is the insurance industry. They've only recently started allowing for codes to express in person versus telehealth. Do you feel like they're behind the transformation, or do you think that they're more of a headwind or a tailwind to the transformation?
I think they are entirely following the lead of CMS. So, as the federal government goes, so do the insurance companies. So, when COVID hit, the federal government, CMS said, you will pay for virtual visits at the same rate that you will for in office visits. And then the insurance said, okay, we will follow suit, but we needed that to happen. And it looks like they're making that permanent, which is long overdue. But that is culturally quite disruptive for the fourth audience, which is our physicians. So you can imagine they quite rightly place a premium on face to face personal relationships, which is why they got into the business. They're healers and they want that personal relationship. So there is probably the resistance is probably coming more from physicians than from insurers at this point, and they have legitimate concerns about the quality of care. And what if I called with a cough, and if it was a garden variety cough, then fine, they'll send me to go get some cough drops. But what if it was throat cancer, and would they catch it if it were something that was an outlier? So not that an office visit would do that, but they do have legitimate concerns about the continuity of care that would be delivered through virtual visits.
Right, right. Thanks. Another thing people don't realize is what a big percentage of healthcare systems are in fact nonprofits, right? They sort of think a hospital is a hospital or a healthcare system is a healthcare system. And a lot of the very large ones are in fact nonprofit enterprises, which is just a tax designation, but it sort of comes with emotional baggage and a tax designation and a different way that
Yes.
people think about an organization. So as a marketer, when you're marketing as a health organization that's a nonprofit, does it change your framework of how you think about your marketing mix, how you think about your marketing messaging?
It does. And we have the luxury of standing on our not-profit stance and being able to say, we think everybody deserves great healthcare. It doesn't matter what their economic status is, or their age, or their ethnicity. And particularly in the southwestern states that we serve, we have a large number of people who are part of the Native American population, who are Hispanic. We have a lot of people who struggle or are on the margins of society. All of those people deserve great health care. And we have the luxury as a not-for-profit to have one set of messages, and they apply to everybody, which is regardless of your financial status, come in, we want you to be well.
That's great. Yeah, I guess it is an advantage that you have as a nonprofit. Um, Obviously, not all nonprofit healthcare systems are in fact cash positive, right? So
This
many
is
of them,
correct,
yeah,
yes.
many of them sort of struggle just as a for-profit hospital might. Um, do you feel like part of your team, wears the development hat as well? In other words, sort of you're not only marketing for healthcare services, but you potentially sometimes wear the nonprofit fundraising and development hat as well, or is that completely separate from your mission as a CMO?
It is separate. We have a foundation, but we work side by side with them. So it's not separate. It is a separate legal entity, but often our marketing campaigns, we know that there's an outreach we have to do, say, for children who are living in poverty. And if we have a campaign that we would like to launch, we can look to our foundation to actually see if we can get a sponsor. So it does help that way, but we work hand in glove with them.
Okay, that's really interesting. Um, One thing that sort of, I think all marketers are struggling with is sort of some blurring of the lines, for example, between earned media and paid media. Certainly influencer marketing, but also some branded content that may or may not be as clearly labeled as the FTC would want it, are all
Right.
areas where things that might be paid media, but look a little bit like earned media, or at least are consumed by the consumer as earned media. Do you think the industry is doing enough with regards to labeling in that area, or do you feel like there's likely to be increased regulation from the FTC in that area?
I think they're doing a pretty good job simply because, by definition, most people who are in healthcare are wired for the do-gooder point of view. And all healthcare systems are looking for those great stories about triplets that were delivered and saved from neonatal disaster. And so a lot of the content that is put out there is genuinely earned media ready. They're not representing it in advertorial or native advertising. So I would be pretty surprised if anybody was putting forward those things in a ambiguous manner. Most are pretty darn clear about what is internal content that's being put forward to the public.
What about outside the healthcare industry? Do you feel like other industry categories are perhaps not um, being quite as clear as to where the lines blur and
Other industries are a little bit more creative, shall we say. I don't think they're being duplicitous, but they are. Whenever there are ambiguities in the regs, somebody will play the margins, and there are certainly people who are playing the margins until those loopholes are closed, and then they'll find new loopholes. But that's the way it works.
Right, right. Another topic that I think holds a slightly different view from the perspective of running a healthcare organization as opposed to just a traditional marketing organization is privacy, right? There are privacy implications as it relates to healthcare related privacy that I think go a few layers beyond sort of typical privacy as far as, knowing that I'm in market for an auto is a little bit different than knowing that I'm in market for a colonoscopy. So, what's your thinking there? Do you feel like the government should sort of be the arbiter there? Do you feel like the platforms really should bear the brunt of the responsibility, or do you think it's really sort of more of a collaboration between the regulators, legislators, and the big players like the Googles and Facebooks of the world?
Well, the platforms are definitely fox in the henhouse because they make their money by selling us advertising. And the more they know about Kevin and Alex, the more money they make. So I do think it has to come from the government. I don't like to say that, but I do think it does. I do think because of the recent changes in what we can do with cookies or what we can no longer do with cookies, it is going to change fundamentally how marketers have to operate, because instead of relying on third parties, namely these platforms, to do our retargeting for us, we're going to have to use first party transactional data, which means that if you don't have a customer database, or if you don't have a back end system or some middleware that will connect all of your transactions and put them in one place, you're going to have a tough time doing personalized marketing. And that's kind of table stakes at this point. So for those industries and those companies that don't have primary data, and particularly transaction data, meaning what did Kevin buy with you last? Did Kevin just change his address? Those kinds of things, it's going to be very hard to compete if you don't have that from inside your company instead of looking for an overlay or for outside sources of that.
Yeah, I would see. It would seem then that the current push, with the elimination of third-party cookies, which the can got kicked down the road another year or so recently, at least with regards to
Yes.
Google, although Safari's been third-party cookieless for a while, it seems like that's been a catalyst to sort of reinvigorate first-party data collection by the marketers, right? Where perhaps they had been a little
Yes.
bit slow to do the digital transformation. I always think of healthcare as perhaps not being at the forefront of digital transformation, but I know that's been a big part of your push. Do you feel like they're ready to sort of build the back end business intelligence and CRM platforms that are sort of secure but give the marketers the tools that they need?
I think they are, and I think they're scared. And they're scared for a reason, and it's legitimate. If you make mistakes in healthcare, somebody dies, so you need to be very careful. Or just as bad, if you make a mistake, someone goes to jail, because the privacy regs on PHI are quite fierce, as they should be. So the single problem that all healthcare entities, whether it's insurance or it's on the provider side, is what do you do to marry all of your EMR data? So whatever's on Cerner or Epic, and then everything else. So for me, for example, my Cerner record. So Banner has Cerner. My Cerner record probably has 1,000 fields in it, and with all manner and kind. And I don't have a complicated health situation. I go once a year for a checkup, but that's still 1,000 fields. And then there's all of my call center data, my web browsing history data, my email data, all my response data, my social platform data, all my other transaction data, my billing data. So the challenge is to put those two together so you have a complete view of my background. And what everybody struggles with is that 1,000 fields. If you're dragging around 1,000 fields for Kevin and Alex, you can't get anywhere. The cost would be too high, and you would never be able to pass your files. So what you have to do is abbreviate. So what are the things that are the most important? Who's my primary care doctor? Have I had my annual checkup? Have I had my flu shot? What are the most important things? And how do you take the small subset of your electronic medical record and then add all of the transactional data from the other things, like how often I go on the website, how often I call, did I call last night completely brassed off about a billing issue? Those are the things that are much more predictive. But everybody has to, all the health systems have to come up with a data model that is good enough. And I think that good enough often gets, they're looking for fantastic, and it's, you're not going to be able to do um, uh, evidence-based marketing off of, off of a smaller one. You're not going to be able to do health outcomes based on that, but good enough is a tough place for scientific organizations that are used to having perfect data. So we have let, as an industry, we've let the perfect get in the way of the okay.
Well, I would imagine even as marketers, right? Once you get access to the data, you want perfect as well.
Yes.
But one area where you'll never get perfect is the marketing mix. In particular, finding that perfect allocation between paid media and earned media, and then within paid media, finding the perfect media mix. Have there been any sort of ways of structuring your thinking around that have helped you sort of decide, at the macro level, first of all, what are the bucket sizes for paid media and earned media? And then once you get down within those, sort of how you're allocating between PR, digital PR, content marketing, SEO on the earned media side and social. And then obviously on the paid side, you've got a plethora of upper and lower funnel, methodologies and channels you can pick. Is there sort of uh, a good enough model for that you think marketers should embrace to sort of help them think through that budgeting process?
That's an important question, and everybody would have a different idea of it. I aim for about 4x. So if I take a look at, typically at the end of a year, I look back and say, how many earned impressions did I get? So last year earned was about 1.5 billion. And then I typically look at, okay, I should be paying for about 4x. And if you think about just common sense, and this is entirely opinion of Alex, unsubstantiated by any science, but if you think about it, something that you hear about in the news is more credible than something that is paid. We all know when we're being served an ad. So I typically staff for and aim for about 4x on the paid side than I do on the earned side. But I would love to hear if any of your audience has a better way of doing it. That's complete spitball of what I shoot for.
Yeah, I mean, I think part of the challenge with any kind of numbers like that is, not all impressions are created equal within either the paid or earned ecosystem. And one of the areas where it sort of becomes blurry is, when you do get an earned media hit, often that ends up getting socialized in social media and it becomes your best performing ad, right?
Yes,
And so
exactly.
they feed off of each other in ways where they would have never fed off of each other in the past, or at least not to the same magnitude. So I think that's where we get into the blurry areas. I'm not sure that there's any perfect benchmarks, particularly given the fact that there's a difference between, getting mentioned on a community newspaper website and getting mentioned in the New York Times, like, really trying to articulate what was the reach of that mention, right, is tough even with
Yes.
the best PR tools. Um,
It does bring up the importance of owned, because really the paid and the earned really only exist to service the owned.
exactly.
That's where the content comes in too, because if you're putting out content that is truly valuable, then your search results will get dramatically better, which means your website traffic will get better. And allegedly, that should lead to conversions and more revenues. But that's the one I probably watch the most closely. And interestingly, I help our management team set our annual initiatives, and that's what our bonuses are paid out on. So this was the first time since I got to Banner, I got them successfully to agree to a website traffic to get them to understand most people are going to be engaging with you for the first time online. They're not going to be coming into a clinic. So let's make sure they show up at the front door of our website.
Yeah, I mean, it's interesting that you've been able to sort of, get buy-in. One of our unexpected tasks, having started as an SEO shop in '96, was, content was king. Even back then, they didn't call it content marketing. It was just, the engine that drove SEO. And part of the big task was figuring out how to get buy-in within all the channels of the organization, from customer support people to salespeople, et cetera, to co-create content internally. And has there been anything that has helped you? Because I'm sure that there's just wealths of information within your clinicians, right? But they're busy, right? And so content
Yes.
creation isn't on their to-do list, or at least wasn't in the past. Have you been able to sort of find a carrot or stick that gets them excited about content creation or content co-creation?
It's been the carrot, and you're right, because they are so busy and that it's not their favorite thing to do. But what we do is observe trends, and you can tell by just looking at Google Analytics what topics are trending. And if we find out that valley fever or Lyme disease or something is trending, then that's our signal to go to them and say, hey, there are X million viewers that are looking at Lyme disease content. Can you please give us 20 minutes of your time? And then we're much more likely to get the interview from them or get their time, because they know that if they put something out there, that will get traffic and they will get exposure.
Have you found that some of them have their own social media profiles, and you can sort of tell ahead of time that they're going to be either more charismatic or just more clear in their content as they produce it? Does that sort of guide you internally as you find your subject matter expert when Lyme disease is hot?
Well, this interview is going to be publicly available, so I'll be diplomatic and say, let's just say we know we definitely have some very articulate, very comfortable in front of the camera, media ready physicians, and we have some who are less comfortable doing that. So we try not to go back to the usual suspects are often tapped over and over again. We try and branch out on those. We typically don't have a lot of people with independent media presences, but we try and constantly be chatting with people who are there's some people are just that way. They just enjoy public speaking, and if we can find them, we use them.
Yep, yep. Have others asked for essentially media training to make them better at it?
They have not. If they're not good at it, they know it, and they really would rather not participate at all.
Okay.
We have found that if we boil it down to a formula, and if they know that they're not going to have to ad lib it, and we find that if we bring the video team to them, and then if we have a skilled interviewer, so they're answering questions, one, they're much more likely to be spontaneous. They're not reading a prompting card, and they're much more comfortable. And if we can say, look, we'll get you in and out in 7 minutes, you'll have somebody there, easy peasy. And we typically send them a couple of clips of their colleagues who have had interviews, and they look at it and say, oh, I can do that. If it's a question mark or they don't know what they're up to, they think it's going to be a 60-minute segment, then we don't get a good response. But if they know, oh, I can do this, this will be quick, they're pretty comfortable.
Yeah, I think that that's great advice as far as making it interview format, as opposed to, telling them that they have to just talk about a topic. If you have somebody internally who can act as the interviewer, or multiple people who can be the interviewer, I think it's a lot easier for people to sort of answer a question as opposed to speak extemporaneously or spontaneously.
And speaking into a camera and just sounding off is just, it's never natural or comfortable.
Right, right. Well, just to finish off, obviously, there are shiny objects popping up almost every day within the ecosystem from different providers and from different platforms. Is there anything that you're particularly excited about going on now, or that you sort of look forward to testing under Banner Health or any of your other hats?
Let me see. I think one of the most successful things, I don't know if it's a shiny object, but just setting up our online newsroom, because news stations are so understaffed these days. If you have a really good, really easy to use newsroom, you'll have reporters that just cut and paste articles wholesale and just push them out there. And then we set up a platform that allows us to connect directly to TV stations' newsrooms to their camera directly, so we can do split screen and we can do graphs and things like that. And we got tremendous placement. Once we started with that online newsroom, we got tremendous placement that way. So it's something that is pretty simple to do, but you have to decide to do it and stop doing it your old way. But once we did that and actually pulled it then onto our own servers, it made things a lot easier on the earned media side.
Yeah, it sounds like you've really been able to glue your own media and earned media together in a way that you get at least two bites at each apple.
Yes,
Yeah,
yes,
so that's I think that's
that
great
was deliberate.
advice for anybody of the scale where it makes sense to do that. Obviously, you need to be of a certain scale before setting up your own newsroom makes sense.
Right,
But I think
yes,
that's a great idea, and I'm going to recommend that to folks who are big enough that they maybe they need a room with a green screen in it or a room with a moderately decent camera and a decent microphone.
yes. Even
Really,
if it's just a storeroom someplace, and now with so many people working remotely, you can find literally. We found a storeroom and converted it to a green room, and it's in use constantly now.
wow, wow, that's interesting to hear. Well, thanks so much for joining me.
It's
This
a
has been great.
pleasure.
I think we covered a lot of topics that people will be fascinated by.
Okay, wonderful. Always happy to help. Thanks, Kevin.